All right, hello, and thank you for joining today's informational call for the Region 5 Public Health Training Center's funding for student field placements and collaborative projects. My name is Rhiannon Bednar, and I'm the project coordinator at the Region 5 Public Health Training Center. We also have Donnie Zemmel, our training and engagement senior manager, here with us today as well. So just a couple of housekeeping items. You all are muted upon entry, and we do ask that you just please stay muted to avoid interruptions. If you do have any questions or comments to share, though, please feel free to add them into the chat. We will have a designated time for Q&A at the end of today's call, so we'll be keeping track of any questions that come into the chat, and then we'll wait to answer those until the end. At that time, you can also come off mute and verbally ask any questions as well. But if you would like live transcription for today's call, you may do so by going to the Zoom menu bar and selecting Show Captions. And if you don't see it there, try resizing your window to be wider and then turn on Show Captions. And lastly, this session is being recorded, and the recording will be posted on our website, and we'll send out an email once it's available. Okay, so to start off, just wanted to provide a little bit of background information on our training center. So the Region 5 Public Health Training Center is part of the National Public Health Training Center Network, a consortium of 10 regional public health training centers and the country's most comprehensive resource for public health workforce development. So collectively, we seek to strengthen the skills of the current and future public health workforce through learning tools, continuing education, and student development. So the student field placements and collaborative projects that we help support allow students to collaborate with practice agencies on capacity building projects that really help to support the organization's work in addressing social determinants of health. So within the U.S. Department of Health and Human Services is the Health Resources and Services Administration, which we refer to as HRSA, and that is our funding agency. And as a HRSA-funded center, we are housed at and operate out of the University of Michigan School of Public Health within the Department of Epidemiology. And then we serve a 6-state region, including Illinois, Indiana, Michigan, Minnesota, Ohio, and Wisconsin. So who should consider applying to this funding? Students who have a defined project at a placement site, with the placement ideally beginning around, this spring, and have an unpaid or underpaid opportunity and who meet eligibility criteria are encouraged to apply. So I will get into more of the eligibility criteria on the next slide, but I do just want to emphasize that you already have to have a placement site secured in order to apply. So we here at the training center don't place students into field placements or collaborative projects, but instead we're really here to help support you in your field placement or project. So again, this site does need to be secured by the time you apply, since you'll need to list the information in the application, and you'll also need to have a letter from your site preceptor confirming your placement and if it's unpaid or underpaid. And just a quick note that we define underpaid as an hourly wage of $15 an hour or less, or a stipend of $3,500 or less. To meet the eligibility criteria, you must be a student pursuing a degree in public health. So, something like pharmacy or biology would not be eligible. In the past, this has been open to social work, psychology, and sociology students, but this year it is open only to public health students. And tribal community college students who are enrolled in a health professions degree program, such as allied health or community health worker, would be eligible to apply as well. And you can be a part-time or a full-time student, and it's open to undergraduate, juniors or seniors, master's students, and doctoral students. And then you must also be a U.S. citizen, a non-U.S. citizen, a non-citizen U.S. national, or a foreign national possessing a visa permitting permanent residence of the U.S. So unfortunately, DACA recipients and international students with work, research, or student visas are not eligible for these federal funds. We have had some students ask if they're eligible for this opportunity if they're on an H-4 visa, and unfortunately, students on those visas are also not eligible. And then lastly, you cannot receive this funding more than once. So, for example, if you received funding from our training center for your bachelor's degree field placement last year, you would not be eligible to apply and receive funding during your master's degree field placement this year. So in terms of your field placement site and project priorities. To be eligible for this funding, your placement site must be focused on providing services in a medically underserved community in the 6 states that we serve, which again are Illinois, Indiana, Michigan, Minnesota, Ohio, and Wisconsin. So in the application, there is a link that you can use to verify if your site is in a HRSA designated health professions shortage area and or medically underserved area or population. And so please do use that link when you are applying. Preference will be given to placements in governmental public health sites. So that includes state, local, or tribal health departments. But really, overall, the project you're working on at your site should be designed to enhance public health services and or address social determinants of health. So, this could look like a lot of things. It could look like working on a community health assessment or program evaluation or, providing health education or communications within the community, among many other potential, topics and projects. We do have a list of some sample project ideas on our website if you're interested. And then because we are a HRSA funded center, placements and projects must be in alignment with HRSA strategic priorities and federal executive orders. So if you do have any questions about this, you can feel free to send me an email and we can set up a meeting to discuss this further. We can also stay on after this call today to answer any specific questions that you might have as well. And then your project should be, longer term, usually at least 3 months. And at a minimum, undergraduate students need to complete at least 100 hours, and graduate students need to complete at least 150 hours. So I think with that, I am going to now turn it over to Donnie to talk more about projects and our student practice, community of practice programming.
Great, thank you so much for that background, Rhiannon. So for the two different types of projects that we support students in moving forward. So on the left side here, we have field placements, and these are meant to support students kind of one by one. They are moving forward projects, usually within a public health organization located in or serving a medically underserved community. Remember that medically underserved community is one of the eligibility requirements. And also, this work that the student is moving forward is aiming to build organizational capacity in order to address social determinants of health. In contrast, or compare and contrast, on the right side, a collaborative project is similar in the sense that the project that you're working on is moving forward social determinants of health work. So there are some similarities with the field placement project. However, a collaborative project can include more than one individual. So it could be a group of students, perhaps at your institution, or even students from different institutions, but that are all doing the same or similar work at a single placement site. And then the main difference here in this blue text is that a collaborative project includes faculty involvement. So that faculty member from your institution is involved from the beginning, middle, and all the way throughout the end of the experience. I do want to note here, there's some smaller text at the bottom for Masters of Public Health students at CEF accredited institutions. It is possible that the activities that you do to fulfill your degree requirements, to fulfill your applied practice experience, can double count for a field placement or a collaborative project. If you have questions on this, we recommend that you speak with somebody within your institution, but you can also reach out to us if there are any specific questions that we might be able to help address. All right, let's go to the next slide. Okay, so for students that are accepted into our program, the main requirements include 4 student evaluations. And so you would complete those at baseline, so prior to engaging in your work, midpoint, post, so upon completion, and then we also issue a 1-year follow-up. And then we also need to have a deliverable from each student. So the deliverable is meant to showcase what you did during your field placement or collaborative project, what you learned, what are the implications for the organization, and what are maybe recommendations or ideas moving forward in that specific type of work. You only have to produce one deliverable, and it needs to be either a scientific poster or a scientific report. You don't have to do two, you just choose one, whichever one you prefer. And we have templates available for students, uh, you know, for either type. So that way, you're working from something and, making sure that you're meeting all of the different components for a poster or for a scientific paper. All right, let's go to the next slide. Okay, so here I'm going to spend a little time describing our summer community of practice or COP programming. And so as I'm going through here, I'll make sure to distinguish and highlight which pieces are required by HRSA, our funder, and then which pieces are not required by our funder, but are required by us as we are the ones running and implementing this community of practice program. So before we get into the different components, just to make sure that we're all on the same page, a community of practice, or we'll abbreviate that as COP, brings together a group of people that have a shared concern, shared interests, passion, and purpose. And it provides an opportunity for folks to be able to learn from one another, to learn from their peers in similar and in different situations and settings, and to be able to improve their current practices. Folks in a COP are also able to work together to move through situations where critical thinking might be needed for problem solving in particular focus areas. So through our COP, students have the opportunity to interact in a virtual setting at a couple different time points throughout the summer. So our program, all the components occur virtually or are available asynchronously, meaning you can access them on your own time online. And so for the live pieces, we have at least three opportunities for students to connect with one another and also with our team. So in May, we have our first session, our orientation, and we also discuss a little bit around best practices and strategies for entering and exiting communities. In June, we host a panel discussion really with some alumni and some other folks that are newer to the field and are not that far removed from where you all are. So you'll be able to hear some insights from them and also have an opportunity to engage with them and ask them some questions as well. So that's going to take place in June. We skip July in terms of live sessions. And then in August, we come back and have our closing session where we spend some time on reflection, what you've done so far in the course of your field placement or collaborative project, and then thinking through what are the next steps. How do I take what I've learned and write stronger points, bullet points in a resume, for example? How do I talk about what I'm doing in an elevator pitch in a really short amount of time, right? So then aside from the three live sessions, we have those asynchronous or self-paced pieces. There are mini tutorials, recorded trainings. There's a wide variety of types of material that you can access within our private internal site for students that are accepted. And then lastly, here we have something that we just started last year, actually, a virtual coffee chat. So we will offer a couple times throughout the summer opportunities for you all to network with one another, to get practice in networking. Sometimes it can feel a little strange to do that, especially in a virtual setting and also in person, right? But just to be able to be a little bit more comfortable and to know what to say and how to say when you're meeting a new person and talking about your field placement or collaborative project experience. And so for the students that engage in our COP and complete the evaluation for at least two of the three live sessions, attend at least one of the two virtual chats, and then they also complete those required surveys. Remember, there's three of them, well, technically four, but three for the duration of the summer. And then you also submit your deliverable. You will earn a certificate of completion. And we've heard from alumni of our COP that that is a really helpful thing to say to potential employers, to put on your resume that you earned a formal certificate of completion from our program. All right, let's go to the next slide here. We don't have too many more slides. So some of the benefits to applying for and being selected in our program. Obviously, there's that funding piece. So uh, we are able to offer $3,500 per student, and that is paid in a single lump sum installment. And I believe we mentioned this already, but just to reiterate, a student can only receive a stipend from us once. So if you received funding from us in a prior program or prior year, you're unable to receive that again. And aside from the funding, that is a big piece, right? This uh, community of practice is really an opportunity for you to dive a little bit deeper in your public health development and also to get some access to professional development in real time, but also to some professional development resources. So you get the opportunity to put theory into practice, to build knowledge and skills, access to a lot of different types of modalities, live sessions, recorded material, and you get to connect with others from across our Great Lakes states, across our Region 5. All right, let's go to the next slide. Okay, I think this is our last content slide here. So just as a reminder, applications are currently open. They opened earlier this month. In a moment, we'll make sure to put, oh, perfect. We've got it in the chat already. Um, the web link, which has all the information you need, as well as the link for the application. On our website, we do have a downloadable document where you can get a preview of the application. So if you want to download that, look through it, make sure you have all the pieces there before you even start to work through the actual application form. We recommend doing that. And just to note again, as you're working through the actual application form, which is a Qualtrics form, you have to upload a letter of confirmation from your site preceptor. So the application period is currently open and it is going to close just before midnight Eastern time at 11:59 p.m. on Tuesday, April 14th. So you have a little bit less than a month to get that in if you haven't already. And then our team will take a couple of weeks to review the applications. So we do have a pretty robust application review process. Two individuals from our team will review every single application. We use a rubric. We score for eligibility and thoroughness of completion. And then we are tentatively aiming to have notifications out to you all, either way, by Monday, May 4th. So if there's any delays, we'll communicate that, but I think we'll probably be able to meet that Monday, May 4th target that we're aiming for. Alrighty, so I think with that, we will open it up for questions and comments. You are welcome to raise your hand and come off of mute if you'd like to verbally ask a question, or you could put something in the chat. And I think while we're waiting, I'm not seeing anything coming through the chat yet. Miranda, I might hand it back to you to see what questions we want to pull from what we've had asked in previous years. I feel like
Yeah.
from year to year, we have some common questions that come up. So
Yeah.
you can go ahead and
Thanks,
start
Jenny.
there. Yeah.
Thank you. Yeah, so just wanted to start off with some common questions that we've received, and then a few of you had also put some in the registration form as well, so I wanted to make sure that we address those. So one of the questions that we've received is, how do I find a placement site? You know, as I mentioned, we don't place students into these sites, so the question is how to find one. So some ideas that we would recommend would be to, utilize your college or university's careers office. Maybe, ask some of your professors, leverage your, existing network, searching LinkedIn or other career sites. You can also check the websites for state, local, and tribal health departments. You can also check, your state's public health association. So those are just some ideas that we would recommend to find a site. Another question that we've received is, what restrictions, if any, exist for the use of the stipend? So there really aren't any restrictions. The stipends are paid out to you as an individual, so you'd be able to really kind of use it however you want. Another question, if I graduate at the end of summer or the end of the year, am I still eligible? Yes, you would still be eligible, as long as you meet all of the other eligibility requirements. However, if you've already graduated and you're not a current student, then you would not be eligible to apply. Um, if I live in a state outside of Region 5, but I am attending a university in Region 5 and completing a field placement in Region 5, would I be eligible? And yes, you would be, again, as long as you meet other eligibility requirements. If my placement already started and it ends in May, am I eligible? And we would say yes, again, as long as you meet other requirements. However, if you do complete your placement in May, we would still, ask that you participate in that summer community of practice programming that runs from May through August. And then if I'll be making, $16 an hour at my placement site, can I still apply even though that's more than the $15 an hour that we define as underpaid? You can still apply, but we would likely take that, your pay into consideration compared to another candidate who is unpaid or underpaid in their placement. Um, so I see there's some things in the chat. Uh, and so, okay, so you mentioned that the projects will start in spring. Is June 1st considered an okay starting date? Yeah, we've had some students start in June before. I would say no later than June though, because like the end of June is actually the end of our grant year. So, but starting June 1st would be fine. Another question was, what should the wording of the letter from the preceptor look like? Is it just a short letter simply stating that the preceptorship is unpaid or underpaid? Um, yeah, it can be very simple. It can just say like, this student has accepted an unpaid or underpaid placement at our, whatever the site is. It doesn't have to be really very detailed or anything. Um, let's see, was there anything else that came through? Well, I guess I'll also open it up if anyone has, any questions and wants to raise your hand and come off mute, we can do that as well. I think I'm caught up on the questions from the chat.
Hi there.
Hey.
I was wondering if there were opportunities to network with maybe other alumni. And I'm sorry because I joined a little bit late, so you might have already answered this, but if there were opportunities to network with, like for example, past placement um, people or just a general networking support for professional development in like throughout the summer. Um, yeah, sorry. I know that's
Yeah.
kind of a vague question.
No, that's okay. Good question. Yes, so there are some opportunities to network with alumni. So in the June session of our community of practice, it's kind of like a practice panel and networking session. So we do usually invite a couple of alumni to present like on the panel and just share some of their experiences that they've had, as a recent student and then trying to, get into the workforce. So that is an opportunity. We do also invite like all of the alumni from past, years of our community of practice to attend that session and participate. I will say we haven't had a ton of alumni, aside from those on the panel, um, actually attend the session itself, but we do invite alumni to it as well. We also have a LinkedIn group specifically for students who either are currently in our COP programming or are alumni. They had an opportunity to join as well. Again, it's not super active, but we definitely encourage the use of it. And so if you were selected and wanted to really kind of try to connect with others who were in the programming, you could do that as well through the LinkedIn group. And then, in the virtual coffee chats that we have, usually there's two options throughout the summer. That is not open to alumni, but that's a good networking opportunity to, meet the peers that are in the COP cohort, and, connect with them as well.
Okay, great. Thank you.
Mhm.
And then another question I had was about the scientific poster um, presentation. So uh, if you could just give me maybe an outline of what those typically look like, I'm just kind of curious to understand a little bit more about the, um, yeah, what's expected there.
Yeah. So we have templates available that includes like all of the required information for it. But basically in either the poster format or the report format, both of those have to include like an abstract, introduction, methods, results, discussion, conclusion. So kind of like what you would think of as like a scientific poster or paper, but it's not as like for a paper, for example, it's not as like lengthy as you would think of as like a normal scientific paper. Um, we currently don't have any, like you don't have to do a presentation or anything like that as part of it. It's basically like you just submit the either the poster or the paper to us, and we'll review it, make sure it has all of the required components to it, but then we just have to submit that to our funder HRSA as part of like the funding requirements. But yeah, we try to make it as, I guess, easy as possible with like having all of the different required components in those templates that we share with students. And really it's
Okay.
kind of meant to focus more on like what you did at your placement site and a little bit of like reflection on, how it went. Are there things you would recommend for like next steps, that kind of thing, as opposed to more of like a scientific study type of poster or report. Hopefully that answered that. I feel like that was a little long-winded.
No, that's exactly what I was looking for. Because I'm anticipating a placement that is probably not going to include any scientific research, you know. So I was just kind of curious what that would look like. So
Yeah, and that's how it is with a lot of the students that we've had in past years too. It's not necessarily like some type of scientific study that they're working on. It might be like, they're providing health education in a class or, something along those lines. But um, each of the components that are required, we kind of try to help provide a little bit of language around like what exactly we're looking for, so that you can like, yeah, there's like you don't think of like methods necessarily as like being in a health education setting or something like that, but we still try to just like provide some guidance on like what you could write in those different areas.
Yeah, I'll just add a little bit more to that, Rhiannon. I'm thinking back to what my internship was like many years ago, and I was not engaging in research in, I think, the traditional sense that we often think of. I was working in a health department as a sanitarian intern. So I was every morning in waders going out and scooping water samples from different recreational lakes. And so we weren't putting the data that we acquired from analyzing those samples into any kind of research paper or manuscript or anything like that. But in that example, in that scenario, you would say, for example, here's the background information about why we're collecting water samples to test for things like E. coli that might affect people that are recreating in those waters and those beaches. The methods, what was it that I did every day? The results, what were the trends over the course of the summer that we found from the X amount of different bodies of water that we had sampled, I and then collectively with the other interns over the summer. So you see, like, you just have to, you can be creative in how you're formatting and formulating what you did in within that scientific method kind of framework. Yeah. Okay, I see another question that came in. Wondering if there are previous students who have participated while doing field experience of 35 to 40 hours a week. Is there a cap of how many hours the field experience is? I don't think that we have a cap per se, but we do have a minimum hours requirement. And Rhiannon, you might need to correct me. I don't want to say it incorrectly. Is it
It's 100
ah,
hours for undergraduate students and
okay.
150 hours for graduate students.
And so that is not an upper limit cap, that's a minimum. So we ask that undergrads do a minimum of 100 hours and graduate level students do a minimum of 150 over the course of the whole internship or field experience. So however that breaks down week to week is really dependent on, your site and what you work out with your preceptor.
Awesome. Thank you.
Yep.
Yep. And I do see that we're over a minute, so I will probably wrap us up here for at least the recording sense. But like I mentioned, Donnie and I can stay on for a couple minutes after if you did have any other specific questions. But just wanted to say thank you so much for joining us today and for asking really great questions. If you have any questions, as you're looking at the application or just anything that you want to talk through further, please don't hesitate to reach out. And thanks so much. Have a great day.